as the patient was going to be going into and coming out of that surgery. So, that shared decision-making, that mutual respect, the communication, those are all really key. And what we're hoping with the conference and with the theme this year is that, both the healthcare providers and the patients will be given the opportunity to discuss how you foster that, learn some of the tools that we have available to enhance it. And, and that's the thing, too, with the conference is that it's not just for healthcare providers and it's not just for patients. Our speakers, when they come, they're told that the audience includes all of the stakeholders in healthcare. So it is clinicians, it is patients, it's insurers, it's everybody coming to the table and getting the information. And, we've got some great international and some great local speakers who are coming, and it should be a really, really interesting discussion and really informative sessions.
Okay. I want to give you an opportunity again, Ms. Jennifer, just to highlight the salient aspects, some of the things that you want to get across to our listening and viewing audience, like dates, times, closed registration. But we did go over the fact that if you're not going to attend, please let the organizers know, because then that'll be one space, because the expectations. We'll talk about some of the topics, and I'm sure that you want to give a big shout out to some of your sponsors again, but that list is so long that we'll need another show
just highlight
for the sponsor.
The top two.
As well.
Yeah. Thanks, OC. So the conference, it's our 9th annual healthcare conference. It's being held October 18th to 20th at the Ritz-Carlton. It is being offered free of charge thanks to the generous support of our sponsors. We have Ironshore Pharmaceuticals as a Premium Plus sponsor, the Health Services Authority, Pinnacle Media, and Tower Marketing as our premium sponsors, as well as our ministry. And as you said, registration, unfortunately, is now closed because we have been fully subscribed. But if you have registered and you're not going to be able to make some of the sessions, please do let us know so that we can offer that space to someone on the waiting list to come along. Our webpage is www.healthcareconference.ky, and if you go to that website, you'll get some information on the conference, and after the conference is over, you'll find the presentations will all be uploaded there. And big thanks to Government Information Services, the team there, for coming and videoing that and making it possible. And, the sessions from previous conferences are up there as well. If you're on Facebook, you can like us and get the updates on Cayman Healthcare Conference. And if you're on Twitter, it's at Cayman_health. That's the Twitter feed for the conference. And the theme is Managing Your Health, the Empowered Patient. So we're going to be talking about a wide range of topics, such as day-to-day management of your non-communicable diseases, understanding when your health symptoms signify a trip to the emergency room versus not, and some of the developments in technology and its impact on healthcare. We're going to have some panel discussions. We're looking at focusing on children's health in particular, and some other subjects. And it's just an opportunity to come. You'll be able to sign up for the Health Services Authority patient portal, where you can get online and manage your file. You'll be able to get your flu shot. The flu season is coming up, and also you'll have the health check station as well, where you can get a quick shot of what your numbers are looking like. But as well, we'll have all of the exhibitors who will be there offering the information on the services and products, and hopefully have some really good discussions. And, as I was mentioning earlier, my challenge to everyone at the end of the conference is always to take one thing that you've learned and put it into action, because that's one of the big things that, we all know. We all know what we should be doing, we know what we shouldn't be doing, but it's putting that information into action. And sometimes it's easier to focus on taking one thing, doing that one thing, and making that one improvement, and then it often cascades into a number of other improvements. So, eating the elephant one bite at a time, so to speak. So finding that one thing that that one nugget of information that you can now go and put into action. I mentioned earlier, last year's conference was Food for Thought, focusing on the link between nutrition and health. So after the conference, the challenge I gave to myself is my family and I now try to make sure that we have at least one vegetarian meal a week. And, just sort of focusing on that and as a mostly achievable task that we've done. And, it's facilitated the discussions within my family, my kids and myself and my husband, about healthier options, and looking at getting in the kitchen together actually and cooking some of the meals together, which has been really fun too.
Great. Now I have no doubt that work has already started for next year's conference, because these things get so big that you have to start planning in advance as well. But let's talk about the work that is involved in putting on such a conference, despite the fact that you've done it for 8 years before. This is your 9th year. The work, I'm sure, doesn't get any easier, even though you may be able to do it with your eyes closed to a certain extent.
We have an awesome planning team that puts the conference together every year. The planning committee is chaired by the CEO of the HSA, Miss Lizette Yearwood, and other members from the HSA are on board, as well as representatives from the Ministry of Health. So we've got quite a good group around the table. Tower Marketing also provides support. And tremendous support in terms of facilitating the organization and reaching out to speakers and sponsors and so on. So, as you can imagine, the conference runs over 3 days. We facilitate, dozens of sponsors, dozens of speakers, and over 1,000 delegates. So it is a pretty big piece of work that has to go on, and it is something that we sort of refine every year. Every year we tweak something, make it a little bit better, a little bit easier to try and put it together. But it really, and then there's the volunteer team that is there to sit at the registration table and welcome everybody. Those are all HSA staff members who volunteer their time to come and do that too. So it you hear the expression, it takes a village. And it really does take quite a number of people to make this conference happen. And I do want to thank everybody on the planning committee and all of the volunteers, because without their time and their efforts and their commitment, we wouldn't be able to produce the conference to the level that we have.
Well, Ms. Jennifer, again, I want to thank you for making yourself available. I want to wish you all the success. I'm sure it will be a success. The conference taking place from the 18th to the 20th of October as well. Folks, I want to thank you, our listening and viewing audience, for allowing Radio Cayman, and by extension For the Record, into your homes, into your vehicles as you traverse the busy roads of the Cayman Islands, into your places of work, whether it be an office cubicle or if you're working in the outdoors. I also want to remind you that we are our brothers and our sisters' keepers. There is always someone out there who's less fortunate than we are, and I ask you to extend a helping hand to them. If you can't do that, then I suggest you donate to a worthy charity, because we always want to consider those who need, not necessarily those who want or even those who crave. And I also want to remind you, I'll change my little closing comments this morning to say, while we are our brothers and our sisters' keepers, we also have a responsibility to ourselves. And one of those responsibilities is to ensure that you try to stay as healthy as you possibly can. That will involve following the directions of your healthcare providers, providing them with the relevant information, telling them about your concerns, and they in turn reacting to you, giving you the advice, and of course, going hand in hand with that is with you following that advice as well. We have very many very good healthcare professionals here in the Cayman Islands. We have seen the quality of the service provided here in the Cayman Islands improve on a massive scale, to the extent now where many procedures where we had to go overseas before, people are now embracing the opportunity to have them done here in the Cayman Islands. And what does that do for you? It helps you to be with family, with friends, to get the direct support of family and friends here in the Cayman Islands as well. And for those of you who are in the health care industry and who provide that service, we are extremely, extremely grateful to you as well. So I encourage you to continue to support your radio station, Radio Cayman. Join Sterling Dwayne Ebanks at 12:15 for Talk today. And as usual, we ask the good Lord to bless these three beautiful, wonderful Cayman Islands.
For the Record is brought to you by Fidelity Bank. For all your banking and pension needs, call or visit a Fidelity branch today. Vamped Motors, the only authorized Ford and Toyota dealership serving the Cayman Islands. And Cayman Pharmacy Group, with locations in West Base and professional pharmacy at CTMH Doctors Hospital. The Cayman Pharmacy Group has a location for you just around the corner. And Seaboard Marine. With over 35 shipping ports, find your shipping solution by calling Seaboard Marine at 949-4977.
From district to district, moving through the waters to Cayman Brac and Little Cayman. Your station, your voice. All things Cayman. One radio, many people. This is home.
Radio Cayman in the Cayman Islands.